Okay, Don, this is for you. In a study recently conducted in Cook County, Illinois, 66% of those who said they had Medicaid, CHIP, which is Children's Health Insurance Program, were denied appointments, compared with 11% who said they had private insurance. It is a sad fact that people with Medicaid are often turned down by medical providers, being told, "We don't take Medicaid." Yet the Obama administration plans to use the program to cover more and more people as part of ACA. In my experience, I have found that the Medicaid clinics are rife with abuses by the administrating facilities in both billing and lack of actual care. Knowing that this is a problem, what would you do to improve medical access and care?
Well, that's a really touchy subject. Many of these clinics, the doctors that are there are young doctors that don't have the experience yet. Many of these people don't speak English. They come in, they're not able to communicate with the doctor or the medical staff. And we have many children that have serious illnesses. And we really need trained professionals to help them. These poor people end up, being a pawn. They're passed from a nurse to a clinical worker or someone, and we need some way that our children from birth to age 18 or age 21, that we provide them with an education and health care till they get to be adults. Then they're on their own. But we have to help people along.
Okay, JL?
Cook County, of all places. I don't care much for the way they just released, 10 to 20,000 violent criminals on the streets. I don't understand Cook County. However, as far as the healthcare and reaching the proper doctors, the doctors who will actually take the Medicare or Medicaid, whichever. I have addressed that in America Shrugged. It's mostly in cutting the costs of the medical investments that Americans have already made with medical community. Because everything's been paid for, not the doctor's fees or medical fees themselves, but the equipment, the research. We've paid for that, and we really don't need to pay for it again. The prices need to come down, and I believe that would open up an entirely new spectrum of insurance and doctors that would accept that insurance along with Medicaid and Medicare.
Okay, Santa?
Well, about 6 years ago, I went on a tour throughout the United States to all 50 states to visit with governors' staffs, which I did. And one of the issues we talked about was CHIP. And the way the states receive money from the federal government, the way the states raise money on their own, and the way they spend it, I think has to change considerably. With regard to the Medicaid, folks being able to see people on time, keep appointments, etc., and address the workload that they have, I think we're going to have to expand the medical core, the public health core in the United States. It already exists, and it's trained physicians and nurses, and I believe that would be a good help for this particular system. We already have the medical professionals, and if we can increase that a little bit, I think that would help take some of the strain and stress from the way this particular current program is being administered.
I guess in some ways I don't understand completely your answer, because what are you saying? We would train more people?
Well, there are people already trained, and if we wanted to train other people, just like that AmeriCorps thing I was talking about before, we could set up an agency that would wind up saving money long run to provide additional help of medical personnel to administer and serve the people who are taking advantage of the Medicaid program, and also CHIP.
Because you had said earlier, correct me if I'm wrong, that you do not believe in a single-payer system.
I do believe in a single-payer
system.
system.
Okay. Then that fits in with your paradigm. Okay. Thank you, candidates, for answering these tough questions about social programs and the TPP. We will debate war and the military on July 30th, so mark your calendars. To learn more about your choices in election 2012, including congressional candidates, visit rightindependent.org. From Los Angeles, California, this is Judy Frankel saying thank you and enjoy your summer day.